Today we're going to talk about gram-negative bacillary meningitis in an immunocompetent adult. Some of the things we're going to review is information about the patient, the illness, the chief complaint, family history, and other aspects. The patient was a middle-aged woman in her 40s without any predisposing risk factors such as traumatic brain injury, neurosurgical procedures, immunosuppressive therapy, HIV infection, alcoholism, or diabetes. When the patient was admitted, she was presenting complaints of a high-grade fever for 2 days and drowsiness for 1 day prior to admission. There was no history of convulsion, head injury, rash, vaccination, or jaundice. The patient also presents a resolved urinary tract infection 3 days before the onset of the meningitis symptoms. This was treated with oral antibiotics, and she also had no comorbid illnesses. Also, she did not have hypertension or diabetes. There were associated symptoms of drowsiness that were suggesting a central nervous system involvement. Also, the patient was found to be stuporous with a Glasgow Coma scale of 9-15. There was no mention of rash or skin lesions. No respiratory symptoms such as cough, dyspnea, or chest pain were reported. Vital signs also revealed an elevated pulse, but the normal blood pressure. There was tachycardia that could be response to fever or a systemic infection. There were no reported symptoms as vomiting, diarrhea, abdominal pain. There were no bowel habit changes. And also, there were not a lot of symptoms for the urinary tract. That was 10 days prior. There were no musculoskeletal complaints like joint pain or stiffness, swelling, or limitation of movement. Blood investigations were done, and there was an indication of an acute inflammatory response. For the endocrine, the patient denied any history of diabetes. There were no hormonal imbalances noted. The patient had no history of chronic illnesses, regular medications, or substance abuse. High-risk behaviors were denied, no chronic alcoholism, HIV infection, or diabetes. No mention about family or any significant information. Blood investigations revealed moderate anemia, neutrophic and leukocytes raised, also C-reactive protein. Cerebrospinal fluid analysis showed a low white cell count, likely due to the recent oral antibiotic treatment for urinary tract infection. CSV culture eventually revealed growth of Escherichia coli. She was diagnosed with acute bacterial meningitis with gram-negative bacillary. She was started on intravenous antibiotic, and injection of meropenem was continued for 3 weeks with close monitoring of renal function and electrolytes. Bacterial meningitis is a severe infection of the meninges, the protective membranes covering the brain and spinal cord. Escherichia coli is an unusual case, only about 1% of the cases, when the bacteria enter the bloodstream and then invade the central nervous system by crossing the blood-brain barrier or through direct extension from nearby structures. Her meningitis was likely associated with a recent urinary tract infection, and the importance of this case is to acknowledge the rarity of a community-acquired adult meningitis caused by this bacteria when there was no predisposing risk factors related to Escherichia coli. So we need to always consider unusual pathogens.